Anybody out there?
I am.
Oh, okay, because it was so quiet. I was just like wondering if anybody I sound.
Yeah, I'm on the call too.
Awesome. Hi, Steve.
Uh, Paola,
If
do you
I
have
wasn't here, the call wouldn't be on, so I'm here.
Pauline is here too.
Yeah, I see that. Yeah, thank you, Pauline. Paola, could you start the recording when we actually begin the meeting?
The live stream or both, it's already on because as long as there's two people on, it's required, so just, just know that. As long as I have two people on, I was told to record it, so we are live. And
And
to
Daryl's
prevent
here.
any setbacks.
You throwing me under the bus already, Sally?
Yeah. Why not?
Good evening, everyone.
Hello.
All right, we need one more for a quorum.
Where's the little one?
He's napping on the couch behind me, and I'm afraid the moment I speak is when he's going to start screaming. So
Of course.
cross fingers that doesn't happen.
Pauline, do you work from home mostly, or do you go into the office? Do you have to go in? What's it like for you?
So yeah, I've been working from home since March 16th of last year. And starting next week, I'll be going in one day every other week. And then in July, it'll be 3 days every other week. So 6 days a month total.
Nice. I don't know if you like it. Some people like going in, some people don't, but I think it's nice.
Personally, I feel like it's been working really well because before I would end up missing a lot of meetings because of the commute. But I think it'll be nice just going into the office and maybe seeing some people I haven't seen in over a year, but they want to keep our teams like separated. So it just doesn't make a whole lot of sense. As of right now, I think as things open, it'll make more sense. Yeah. But I've been really enjoying working from home. I know it's hard for school-aged parents of school-aged children. That must have been a disaster.
Yeah.
But for me, it's been really nice.
Yeah. That's good.
Yeah. What about you?
Yeah, I feel the same. I love work from home. I don't ever want that to change ever.
Yeah.
I'm fine.
I know. I feel very productive.
Yeah, much more productive actually. Yeah, it's just
I'm
lighter.
2 days a week.
Oh, already?
Since the first week of May. Yeah.
Wow. Oh, wow. How's it been?
It's okay. I mean, it's weird. My desk is so clean now.
Yeah.
Because I'm like, I don't need the papers, I guess, if they've just been sitting here for the last year and a half.
Yeah.
Right. So, but there's usually maybe 3 or 4 other people in my immediate vicinity, and not even like immediate, like kind of in other wings of the floor. So it's quiet.
Mm,
And a lot of restaurants have closed downtown.
Oh no,
yeah,
that's sad to hear.
Mm.
yeah, yeah. Saw some casualties too. I was just noticing up here.
Oh yeah.
That Wahizi Pizza, was it a Wahizi or something pizza place that
Did they
did the
close?
karaoke? Yeah, it's boarded up.
Oh wow.
I don't, it's empty. It looks, it's boarded. So I don't
Mm.
know.
That's really sad.
Oh, Jay's here.
Oh, very good.
Is that quorum?
Yes.
Oh.
Yeah, that gives us 5 out of 9 members.
Barbara is on, so you definitely have quorum.
Oh, great.
Is Laureen Valentine part of your panels, right? She's in the, they're in the attendees. So need to be moved over, just so you know. Oh God, she got it. Cool.
Promoted her? Oh, very good. All right, so do we have some attendees?
3.
Okay, we have a total of 13 participants. Okay, we're calling the meeting to order at 6:36. And I want to begin, as I usually do, with the latest report that I've drawn up on COVID-19 statistics for our community, taken from the Department of Health website. I sent the members of the committee the chart just before 6:30, so you may not have all seen it, but what it shows is that our positivity rates have, for the most part, continued to decline. Zip code 32, which is our which is the zip code with the highest positivity rate, is at 1.06%, and zip code 34 at 0.85, zip code 33 at 0.82, zip code 40 at 0.75. A little over a week ago, when we had our general board meeting, 2 of our zip codes were even lower than that. Zip code 40 at that point was at 0.58, and zip code 33 was as low as 0.48. And for the week ending May 22nd, just before our general board meeting, there were 40 new cases reported. For the week ending Monday, this last Monday, only 34 new cases. So there have now, since the beginning of the pandemic, there have now been 18,269 cases in our 4 zip codes, an increase of 226 since this committee met a month ago, 657 deaths, 7 more deaths since we met a month ago, and actually no additional deaths since our board meeting a little over a week ago. So in terms of adults who have been vaccinated, have had at least 1 dose, we've had over 100,000 adults in this community who have had at least 1 vaccine dose, and we're averaging in the 4 zip codes about 50% participation in terms of having at least 1 dose. Adults fully vaccinated, over 88,600, actually exactly 88,604 adults are now fully vaccinated. And in the 4 zip codes, we're running at about between 40 and 44% adults fully vaccinated. And that seems to be pretty steady, probably because of the larger age groups that are now qualified to get vaccinated. So we haven't really upped to the percentages very much over the last few weeks. Certainly, yeah, compared to a month ago, we're basically the same percentages. So, the president wants us to reach about 70% by July 4th. I don't know if we're going to be able to make it in this particular community. But we have to try harder. We do have at least 3 or maybe 4 vaccination sites open in this community, as you know, at the Children's Hospital, run by New York Presbyterian, at Yeshiva University, run by the city, at Port Washington Collegiate Church, also run by the city, and at the last meeting, Eliezer said that there's a vaccination site, I think he said on Amsterdam Avenue, and around 178th Street maybe, which is probably run by, I think by this Somos Community Care Group. So I'm going to ask, I guess, the community board office to send out some notices to remind people of where they can get vaccinated, because we do have to try to improve those numbers.
So still nothing in Inwood.
Excuse me?
So still nothing in Inwood.
Yeah, well, yeah, actually, what I did not include are the drugstores, and so you have CVS and Duane Reade, which are giving out vaccines. But yeah, there's no city-run site in Inwood.
Steve, I want to question that statistic because the results may actually be better. Because are they just including people who received their vaccination within Community Board 12? Because many people, for example, got their vaccination. For example, people who work for the visiting nurse service got it at the job. UFT members sometimes got it over at their place of work and so forth. So is this only vaccines administered within CB12?
I think vaccines are the site or the address of the person, their residence, not where it was administered.
Yeah, thank you, Sarah. That's exactly what I was going to say, Barbara. The way they identify how many folks are vaccinated in each zip code, it's by where you live, not where you were vaccinated.
And that's being centrally tabulated by the Department of Health?
Yes.
Okay, thank you.
All right, but thank you, because that is an important point of clarification. But yeah, I mean, the Department of Health has done an incredible job compiling all these statistics, and they're easily accessible through the Department of Health website. So let me turn on that note. Let me turn it over now to Pauline. We also have Padmore on the call. So do you want to go first, or should I turn to Padmore?
Let's have Padmore go first. He's been on the ground doing really exciting work, so I would defer my time to Padmore.
Okay, well, I'm not ready to give up on you.
Oh, okay. Well, I'll be here.
Don't give up on her, Steve. Hi, everyone. Good evening.
Okay. Padmore,
Yeah,
how do I identify you these days? Are you an assistant commissioner these days?
acting assistant commissioner.
Doing a very good job acting. Okay. Padmore, go ahead.
Yeah, sure. Thank you so much. I definitely want to, thank all the partners that's on there, especially Laureen, for always being around, supporting, doing a lot of stuff, and it's really trying to just put a lot of things on the ground. So as you may have heard, Steve, and Pauline can speak to this a little bit more, but one of the big pushes that we're looking to do is to ensure that youth are definitely being made aware of the fact that specifically for the Pfizer, that is available to them. So we have been doing a lot of activities with partners, trying to get in front of youth to make sure that they are fully aware of all the information that's available to them and how to access the vaccine. So there are a variety of activities that are coming up. That we have either been working together with some partners or just some partners that we know that we're able to work with and being able to coordinate with them. So specifically for the Washington Heights area, if there's any organizations that you may know of, we'll definitely be happy to speak to the youth committee of CB12. But just to be able to get in front of some of these various organizations that are always providing support and services, resources to the youth or to parents, we'll be happy to be able to do some presentation to that. At this point in time, Pfizer is the only vaccine that is currently available to youth 12 and over. Right now, we understand that Moderna is also asking for permission to be able to submit that as well to provide it to youth, but that has not been approved as yet. So as it is, it's just Pfizer. And so we are looking to be able to ensure that we can continue to provide that support to the youth community in the Washington Heights Inwood area. A few other things that is coming out, one of the things that, as you mentioned earlier, in terms of the COVID positive rate, where it's very good to see that the rate is pretty low. It's, I think right now still just a little bit above. No, it might actually just be beneath the citywide rate, which is really good. I think it's a matter of the continuous messaging that's been happening in terms of continuing to wear a mask if you're unvaccinated, to social distance, and to
Yeah. Just lost. Padmore, are you there? Padmore. I think we lost Padmore. I think he decided to practice social distancing.
Hello? Hi.
Oh, yes. I mean, just to follow up on that thought, it's just we are encouraging everyone to continue following all the social distancing measures that have been put in place. I can just piggyback off a little bit of what Padmore has been reporting, especially about Youth Vax Week, which is very exciting. And I'm sure Lorraine will have a lot more information about that as well. But there are block parties, there are a lot of exciting mobile units and virtual events for people to attend just to get more information, especially if you're a parent and you have a child age 12 to 17 and you just have questions about the vaccine. So we're trying to get as much information out to that demographic as possible. And then there's a really exciting news about school vaccinations. So over 118,000 12 to 17-year-olds have already received their first dose of the Pfizer vaccine, which is about 23% of that demographic, which is pretty exciting. But starting next Monday, IS90, which I believe is in Washington Heights or in Inwood, they will be doing in-school vaccinations for 12 to 17-year-olds. So that's exciting news. And then also just one quick thing about if you're fully vaccinated. So I'm sure a lot of you heard that the CDC and the state accepted the CDC guidelines that if you are fully vaccinated, you can go without a face covering indoors and outdoors. Indoors, if you know that people are also fully vaccinated, but we still, as Padmore was mentioning, encouraging everyone to continue wearing face coverings while you're indoors, especially if you don't know if the people around you are fully vaccinated. And also if you want to be fully vaccinated by July 4th weekend, so you can partake in activities without a mask outdoors, you can get your dose of Johnson & Johnson by June 30th, I believe. So that's pretty exciting. And then Steve sent me an email yesterday trying to get information about the Yeshiva site and also the Fort Washington Collegiate Church site. I am frantically working on that for you. So as soon as I get any information in terms of demographics and data and zip code breakdown, I will be more than happy to share that with the board. For the only thing I received thus far is that from April 7th through June 2nd, there were a total of 10,781 doses administered at Yeshiva. So that's all the information I'm able to receive right now, but we're actively working on your request, Steve. So as soon as I get that, I will be happy to share it with the board. And that's it.
All right, thank you. So that was between April 7th and June 2nd, 10,781 doses at Yeshiva. And you're going to try to get us the zip code breakdown so we can see the impact it's had directly on our community.
Absolutely, yeah.
I appreciate that. And is that site being run directly by H&H or by who's actually running that site?
I don't know. I'm happy to find out unless Lorraine knows off the top of her head, but I am not 100% sure. Happy to
I'm not
find out.
100% sure. I think it's a combination of us.
Okay.
We just gotta find out on the back end. We've just been doing outreach and booking the appointments at this point.
All right, well, at some point, maybe we could have the person running that site speak to our committee. There was someone from Yeshiva, but who came to a general board meeting to speak about it. But it's my understanding Yeshiva itself is not actually running the site. It's being run by some city affiliate. All right, so I do appreciate your trying to get us that information, Pauline. Sally, you have a question?
Yeah, I don't see PS 90 listed in Inwood, Washington Heights. I see a PS 90 in Brooklyn.
IS,
Okay, 90.
IS 90 is on 100, is on Jumel Place,
Okay,
167th Street, something like that.
okay. Are there plans to roll out those? I think it started in the Bronx. Are there plans to roll out those further at our schools?
Yes. Oh, yes. There are plans to include more schools as the program continues. So I don't know whether or not those have been identified yet, but the schools in the Bronx and IS 90 have been already identified to start. I believe the ones in the Bronx have started already, and IS 90 will begin on Monday.
Okay, thanks.
Are the school sites only for the students of that particular school, or is it, can the general public avail themselves of that?
That's a great question. I don't know. I will find out.
Thank you. Because if that's another site available to the community, we should also advertise that.
And one other question, there was just an article on compliance with translation requirements. I wonder how you guys are doing with translation.
So at all of the city sites, there should be language access. We haven't heard anything anecdotally about our sites not complying with language access. I don't know, Lorraine, if you have more detail on that as well. But to our understanding, all of our sites have the ability to provide either a native speaker on hand who's the staff member, or the ability to utilize language lines so that anyone who is visiting a vaccine site will be able to communicate in the language they're most comfortable communicating in.
Yeah, I
Good.
haven't heard anything differently either. As soon as we hear any language access issues, we address those challenges upfront, no matter where we're at on the field. And I'm grateful to say that we haven't had any of those issues brought up to us for Yeshiva University at all.
Great, thank you.
Mary Anderson has raised her hand. Mary, can Mary speak? I saw something saying that she'd raised her hand. Mary, you have to unmute yourself. Mary? Go ahead.
That was actually an error. Sorry about that.
What was the error?
I couldn't get logged in properly, so.
Oh, you didn't mean to raise your hand. Okay,
No, I mean, it was a mistake.
okay. Well, whenever you decide that you want to speak, I'm prepared to recognize you.
Okay, I can say one thing about Yeshiva.
Go ahead. Oh, good. Go ahead.
Since we had our meeting this morning, Yosef said that they are really not getting the numbers of people for vaccinations that they had hoped, that they could do twice as many vaccinations as they're doing. So, they're hoping for some kind of outreach, more outreach, more publicity about the vaccines being available there. So.
All right. Well, we should send something out through the office. I have to check to see whether we have a flyer from them.
Yeah.
So that's good information. Thank you, Mary. So
You're
you
welcome.
really did mean to raise your hand. Okay, is Padmore back with us?
I am back, Steve. Sorry about that.
Okay, you forced us to listen to Pauline again. So,
I don't think there's anything wrong with that.
no, there is nothing wrong with that. So, Padmore, did you have something more to add to your report?
Nothing really. The only thing I would add, as Mary alluded to, and we've been seeing decreases in vaccination rates across the city, across the country. So there are some things we are looking to do. We are being engaging with some new staff, which is being provided through the Vax for All effort. And so that really is looking to be able to provide as many, to how we might be able to be supportive of increasing outreach. So sometimes that's in coordination with other partners, but the Vax for All staff are looking to be able to ensure that they are spreading the word as much as possible across the communities that needs that. So if there's an opportunity for us to be able to work collectively with some of the new staff that we have, we'll be happy to do that, Steve, in terms of getting the word out. Any type of activities that you have around street fairs, resource fairs, open streets that you may know that are coming up, we'll be happy to be able to, of course, to continue to provide PPE, but also to give information about some of the locations that are nearby for vax to be able to be vaccinated. So that's something we'll definitely be happy to work in a coordination with CB12.
Yeah. Oh gosh, I'm gonna lose my connection shortly. Oh. You may lose me briefly. I would love to be able to do a flyer that just highlights vaccine sites in Washington Heights and Inwood, both the city-run sites, the pharmacies, wherever the vaccine is actually available. Is there any way that you guys can work with us to develop a specific flyer aimed just at this?
We probably will be able to do that if I know on the vaccinefinder.nyc.gov site, you put in, although it's kind of specific to zip codes, and I know there are a few zip codes that would be more, that will be aligned with the Washington Heights, Inwood area, and then to identify all the sites that are located in there. We do have a larger Manhattan link, but it's not necessarily specific to Upper Manhattan or Washington Heights, Inwood area. But we can definitely look to work in terms of identifying some of the very specific sites that are in the Washington Heights, Inwood area.
All right, so I'll probably reach out to you in the next day or so and
Yeah.
try to develop at least a complete list so that we can do proper outreach. I was not able, I don't know if you were on the call today with the elected officials. I wasn't able to.
Yes.
Are they still planning to do a walk on Saturday morning up Amsterdam Avenue to promote?
Correct.
Distribute PPE? Right.
So I know it actually has increased to 185th Street. So I don't remember whose office, Laureen, if you could recall, between 175th and 185th.
Jackson's office.
Okay, Councilman Summerman, State Senator Jackson's office is going to be taking care of the 175th to 185th 10 block area on Amsterdam. So the intent is between 135th and 185th. There's a few different offices will be involved with the mass crawl, the distribution, literature, information, as well as especially getting information on vaccination sites. So that will be happening. A few different organizations and CBs and electives are all getting together and hope to be able to be very supportive of that event and make it successful.
All right, so they are going to distribute some literature that lists all vaccination sites?
Right, but the problem with that is the literature that we have is a 1 week like a 1 week window. And that Saturday and then Sunday, then the Monday is going to be potentially new sites. So it just that's the way it works, because usually, correct me if I'm wrong, Pauline, I think it's like every Monday there's usually a new site, a new sites, list of sites that are coming out.
Right. Yeah. So I was going to caution against having a like paper version of locations, only because pop-up sites come and go. And, you know, new sites are listed and old sites are removed. And so we do encourage people to try and go onto the website for the most updated list, but understanding that not everyone can have access to, you know, a computer or internet. You know, if the board wants to, on a weekly basis, be able to print out the latest version, but with a note stating very specifically that it is for that week only. That way people aren't going to sites that maybe aren't there anymore the following week.
All right, that's a good point. Barbara, you have a question, Barbara?
Yeah, I just wanted to, oops, sorry. I just wanted to say, if it was possible that Ebenezer could speak to the superintendent for District 6, because a very effective way of communicating with the families, since kids are going back to school now, is to send flyers home in backpacks. And so if he gives permission for a flyer to be distributed, it can then go, it goes to all the schools and they print it and it goes home in the kids' backpacks. And so that would be an effective way to communicate.
Yeah, that's a great idea, Barbara. And I think that the DOH is already working with the DOE on adolescent vaccine information and to provide parents with this information in a backpack letter. So you're right on target. That's something that would be the best way in getting in communication with parents. And I believe that that has happened already, if not in the works.
And
Okay,
it should be bilingual.
Yeah. Oh, yeah, absolutely. And I think the schools provide the languages in which it should be translated because they know their student body the best, and they will be able to provide the backpack letter in all the languages that are applicable for their particular school.
Great. Where are we on knocking on doors and taking the vaccine to the people who need to be vaccinated?
There is a homebound link that we've been sharing for a few months there. The form has just been upgraded now recently in the last few weeks that we can bump up again to spread to everyone and share. Again, the 877 VAX number is also available. We're now vaccinating anyone who is homebound and seniors 75 and older, whether or not they have comorbidities, whether or not they're homebound, they're seniors. And so we'll come to them and do the vaccinations there. But you have to fill out the form. They'll be contacted, an appointment will be set, and someone will come to their house to vaccinate them.
And if there are comorbidities, is that still limited to 75 plus?
No, if they're homebound folks
Okay.
and they're 75 plus, then they'll get vaccinated. But if you have comorbidities and you're under 75 and you're not restricted to being homebound, then you have to walk up to a vaccine site.
Okay. And do
And
we
just
know?
be on like a healthy person like myself who has asthma and is asking someone to come and administer a homebound vaccine, we want to make sure that we're using the city resources appropriately.
Do we know how many homebound visits we have made in Community Board District 12?
No, we don't, but we can find out that information for you.
That would be great. Thank you.
Sure.
Very good. Barbara, did you have another question? Or did you forget to? Okay, Daryl?
Yeah, hi. Sorry, there we go. I was just wondering, maybe you mentioned this, sorry. Is there any maybe effort to go to, now that it's summer, people are going to the parks regularly, to maybe be at some park entrances, or at least there for certain activities? I know there's a Pride event at Isham Park this weekend. You know, anything like that?
Well, I wish I knew about the Pride event at Isham because I would have been there, sort of.
It's this coming weekend.
Yeah, but I'm being pulled everywhere.
okay.
We would have planned for that. outreach really tries to keep their eyes and ears to the ground to be at all events. However, I will say that the city is doing a great job at making sure all summer and all week for the next few weeks, starting last weekend, we were at all the beaches, most of the parks. We'll be in Washington Heights with the vaccine bus. We'll be sending the flyer, waiting for the flyer. Myself, it'll be Tuesday and it'll be a block party. However, I don't have any information right now for Riverbank Park or any of the parks yet, but that's in the works. Absolutely.
All right, Daryl, do me a favor. I may lose my connection and come back in a few minutes. If I disappear, could you just continue with the meeting?
Sure.
And Daryl, they have come to Inwood Hill Park twice. They came for Mulch Fest and they came for Friends of Inwood Hill Park's Earth Day Festival. So
Oh,
it's
great.
really a matter of us getting word out to other community-based organizations that when they have sites to reach out to Lorraine.
Thank you, Sarah. And Sarah did a great job of connecting us with some folks, and also, Mark Levine's office, for some reason, connected us with a group called Indivisible Inwood, who did, at least they sent 2 volunteers to join us for the last event that we did for Earth Day at Inwood Park, and we'd love to do more events there.
Oh, very good.
Yeah, I didn't even think about it, but Drums Along the Hudson is this Sunday, but it's probably too late to arrange someone being out there.
It really, I'm sorry, they're forcing us now to stay committed to the 2-week plan that we're now rolling out, which I'll be sharing with folks soon. So just because now there's doing a lot of these pop-up vaccinations that we're waiting for. So there's going to be a lot of these smaller events happening and available to the community. We're just trying to make sure that they pump it out to us with enough notice so that we can get the flyers out to you all and do the outreach on the ground, even if it's the day before. So I'm piloting something right now at Polo Grounds where they're doing a vaccine block party. As you can imagine, we have some challenges that's happening tomorrow with this thunderstorm. So we're piloting something there. The community and canvassers went together to knock on doors to let folks know that we're bringing vaccines out there, but that's at a NYCHA facility. So now a little different. I want to see if we can do something, and I'm really pushing hard for something at Inwood as well, because you're right, we don't have vaccines in Inwood. So the more literature, more emails we get from you saying we need vaccines in Inwood, I think it'll help us build the case, right, Pauline and Padmore, for us to continue to push forward on our end.
Looks like we lost to Steve but gained to Betty. So I'm not going to comment further, but welcome, Betty. And I'm sorry, does anyone have, I don't have the agenda in front of me. Does anyone have it?
Yeah, what you need?
What's next, I guess.
Oh, sure. It was supposed to be Julio Batista.
Hi, I'm here.
Okay.
Oh, okay. Then it's Julio.
Well, before we get to Julio, were there any last questions on, on vaccines or anything? Or did you have any other words to impart? Or are we good?
I just wanted to say I agree with Laureen. I was trying to look for my emojis, but apparently I'm using an old version of Zoom and I couldn't find like the congratulatory one. So yes, completely co-sign everything that Laureen said.
Yay. Well, thank you so much.
I wanted to mention, I know folks are concerned about the 44% adult vaccination rate in your district. I'm happy that we're at 50% there, but you're right, we need to increase. And so some of the things that the city is doing now is this: we do have a flyer we can share with you regarding the vaccine incentives. Depending on who it is, they might like it. They have some cool tickets for New York Botanical Gardens. They have a chance for folks to get into a competition and to win some actual money. They're looking at, NYC $25 New York City Public Market. I guess it's a gift card, free 10 ride ferry to the New York City ferry, excuse me. So football tickets, things like that, just to really, I guess, incentivize people to come and join us, and for 18 years and older as well. But at least this will pique folks' interest and you can engage them in a conversation. At this point, this is the part of the vaccination process Pauline, Padmore, and I were worried about in hindsight, which was this part where we have all the resources and now we got to the point where folks aren't using them. And so any way that we can partner up with you all to engage the community and really overcome this vaccine hesitation, it's going to, we love to do it. So the smaller engagement events, any of the virtual, we know folks are getting Zoom tired, but we need to find ways in which where we can have these one-on-one conversations. Maybe we won't get to 70% July 4th, but maybe we can make it happen by August 4th if we work together as a community.
Thank you all. Enjoy the rest of your evening. Steve, it looks like he's back, but we were moving to Julio, unless you had any last minute things to say.
Lorraine, let me just ask you, you said earlier that did you say that we're gonna have a vaccine bus in the community on Tuesday?
There is going to be a Vax bus on Tuesday, June 15th. So I've been waiting for the flyer. I've been told I will have it by end of day today. So hoping I can pump that your way, send it your way before this meeting ends so that we can start distributing that to folks. It's 12 p.m. to 8 p.m. It'll give folks the opportunity. I'm waiting to find out which vaccine they'll be administering there as well. And if it's Pfizer, then we'll know that that's going to be available for 12 and older.
And do you have the location?
Yes, so the location I do have, excuse me, it's going to be 319 Audubon Avenue. And it's 12 p.m. to 8 p.m.
Well, would you know the cross street there?
No, I don't, but I'll find out for you.
All right, I think it might be in the 180s. Okay. So you've wrapped up your report?
Yep, we're all set.
All right, very good. All right, so then, Pauline and Padmore, the two of you have given us your reports. So yeah, let's move on to Julio. Julio from New York Presbyterian Hospital.
Hi, Steve.
He appears to be out in front of Coogan's.
Yeah, I'm outside right on the sidewalk of Coogan's, right?
Yeah, the former Coogan's.
Former Coogan's spot. So let me just sort of piggyback on what just mentioned on trying to get people vaccinated and providing vaccine education. That is something that we at the hospital continue to do. I've mentioned this last time of the meeting, and the offer stands that we have clinicians in multi-languages that are able to provide vaccine education to small groups. Doesn't matter, it could be a 10 association, it could be as small as 5 or whatever people, and so they're available to meet over Zoom and provide some education around that. And we'll be happy to schedule anything that may come my way. So if anyone on the committee feels that or they know someone that's interested, let us know, and we'll be able to try to schedule that so they can get further education around vaccines. So last month we talked about the Armory. I believe the committee wanted to sort of get a number of how many people were vaccinated at the Armory, and the number I've gotten was we had seen 107,875 New York City residents who got vaccinated. To date, we've switched those operations from sort of decentralize it, and so we do vaccinations at the ACN clinics. Again, those are for basically our patients to be able to get those there, who by the large portion are members of Community Board 12, but not counted. They're not counted in the following numbers, which is the ones that we're now doing at the Winter Garden. And so we moved operations from the Armory to the Winter Garden, and to date, we've vaccinated there 3,454 patients. So in terms of what does that mean for Community Board 12, what's the vaccination count per CB12 zip codes? For 132, we've had 14,413 residents were vaccinated. For 133, we have 11,714. For 134, we have 6,593. And then for zip codes 400, we had 7,882. These are our 4 of our priority zip codes. As you remember, we do utilize the NIMIC hotline to be able to encourage people to get there, schedule appointments. The zip codes extended in terms of our priority did include section of the Bronx, Harlem, and Central Harlem to come and get vaccinated, and we're making that push. We continue to support the NIMIC, which is the Northern Manhattan Improvement Corporation appointment hotline. We're still using that for the Morgantown Children's Hospital, but we also utilize that to encourage, to provide sites that are near where the resident live. So it could be, if they live near Yeshiva University, they would go then to Yeshiva University where they're administering vaccinations, or, for example, the Collegiate Church, who's also doing vaccinations. So that hotline is 646-838-0319. We encourage people to continue to use that to get their appointments they want to, and be able to get vaccinated or get information where they can actually go and get vaccinated. So that is my report on that section. Are there any questions with regard to this?
Yeah, the numbers that you read off the 4 zip codes, those are specifically numbers of people vaccinated at the Armory?
Correct.
All right, so about 25.
These include the numbers that were, vaccinated at the Armory.
All right, so about 40,000 maybe of the 107,000, 108,000 New York City were from our 4 zip codes.
30-something thousand.
To 25, close to 40 maybe. Okay, and then at the Winter Garden, since you moved over to the Winter Garden, do I have the number correctly? 3,454, and you referred to them as being patients, but no, these are people from the general public, right?
Yeah, I'm sorry, Steve. Yeah, so the ones of the Winter Garden, the 3,454 are community, community members who have gone to New York City residents who've gotten vaccinated. However, when I mentioned patients, most of our patients are being vaccinated also at our clinics. So not necessarily, they could be also patients that go to the Winter Garden, but most of the folks who are going to Winter Garden are folks that are calling the hotline or getting, as you know, we also distribute postcards that gives the vaccination sites along with the NIMIC hotline. So they could have used that as well to be able to get vaccinated.
All right, and then the Winter Garden again is open. Do you have the hours when it's open?
That's a good question. I have it. Let me look for it, and I'll so I could share that with you.
Okay. Because if I remember correctly, it's not every day of the week.
No, not every day. We were open also for a period of time on Sundays, which is not part of the schedule, but we were open on Sundays for a while to schedule to vaccinate, but we're no longer doing that.
Okay. All right. So, well, I have to acknowledge and thank you for finally providing us with exact numbers of the people from our 4 zip codes who were able to get vaccinated at the Armory. Took a while, but I appreciate having those numbers.
Okay. So just to let you know, the winter, the vaccine, vaccinations at the Morgan Stanley Children's Hospital is Tuesdays, Thursdays, and Fridays from 9 a.m. to 7 p.m. And then Saturday, we do it in the afternoon, a 4-hour period from 3 p.m. to 7 p.m. And of course, the Morgan Stanley Children's Hospital is at 165th and Broadway.
All right, very good. Thank you. Sally, you have a question?
Yes, now that you no longer need the excess capacity at Allen Hospital, where are you on reopening the psych unit?
That is still under discussion. I'm not sure when that would happen or if it happened. As I mentioned to Steve, you know, there were considerable investments to convert that into basic ICU. And there will be a considerable amount of funds also necessary to restore it back. So I'm not sure yet when that and what's the game plan in terms of the psych unit.
Okay, and my second question is, do you have any information on psych admissions from R4 zip codes to other New York Presbyterian facilities? In other words, not going to Allen, so where are they going?
Well, you know, the process of admission has not really changed, has not changed at all. So as you recall, even when the Allen Hospital was open, people who were brought in for psych were brought into the Allen Hospital. They were evaluated, stabilized, and then sent down to the Columbia unit where they would then, you know, be there. And then if they needed to be admitted, then from there, they would be then channeled off to either the Allen or, you know, wherever else they would find a bed.
Right.
So that process has not changed at all. And you know, we you know, still have the Milstein Hospital where we're still you have in beds there, and also the Westchester. So I do not have the count in terms of, you know, how many people have gone through the Allen Hospital and then sent down to Columbia to then be admitted if they needed to be admitted in the location. So I'll be happy to go back to that unit and get some you know, some numbers in terms of the patients.
Yeah, it'd be helpful, because I know that the need for psychiatric services has skyrocketed with the pandemic, and I'm just wondering how many of those people are now out on the streets versus being in inpatient care.
Right.
All right, well, Sally makes a very good point. And starting with the idea that that you don't appear to need those beds any longer at Allen, which may have been upgraded to serve COVID-19 patients. But the demand for those beds should have decreased significantly, and I think we have every expectation, and I hope so does the State Health Department, that those beds will be returned to their original purpose, according to the Article 28 certificate, that they should be used again as psych beds. The process may remain the same, that people are still being referred down to 168th Street for evaluation before they are admitted. But now we don't have the 32 beds at Allen available to them where they can be admitted. So that is from our perspective, that is a problem. Barbara?
Yes, I was once in the emergency room with a person who was under great distress. And I asked the doctor, there was no bed available. I asked the doctor, though I was told it wouldn't be a problem because we had private insurance. I asked the doctor, because there were other people there who did not have private insurance. I asked the doctor, what will happen if they can't find a bed? And the doctor said, if they can't find a bed for them within 48 hours, they're just discharged. Is that true?
So let me ask you, when you say you were, where were you when you said that you were somewhere?
168th Street, 168th Street, the emergency room.
Okay, so that if a patient requires to be hospitalized, they will keep the patient and they will find a bed either, we have Gracie Square Hospital down on the 70s.
I know where the hospitals are. But there were like about six people, adolescents. And they said, if there's no bed available, we medicate and try to stabilize. And if there's no bed available, in 48 hours, they're released. I was told that.
Okay, but that's something I will have to follow up. But now I don't, if we don't have any adolescent beds and never had any in Columbia. So any adolescent issues will be sent to Westchester.
Westchester,
Correct.
exactly. And that's a problem, that you do not have adolescent beds in the community. Where I would say probably 80% of the people in the community don't drive. That's a big problem. We've raised that
But again-
before here in the committee.
I
right?
understand, but again, at Columbia, we've never had adolescent beds for, at Columbia, even before the decision to transition out of the Allen.
But
And I understand the need. I understand what you're advocating. I understand the needs, and I know what you mean. But however, that is something that we've never had, and we try to work with the city. I mean, I've had cases where we had adolescents that needed to be admitted, and we worked with other hospitals to be able to do that.
Okay.
And I've personally have done that.
Barbara, that's one thing we advocated for in our original resolution, is not only did they return the 30 beds, but they add 30 child and adolescent psych, because we recognized that that's a resource that's lacking in our community. Julio, what would be helpful, as long as you're gathering statistics, I'm interested not just in people who would have come to Allen, who went down to CPEP and got evaluated and then sent out. I'm interested actually in what the trend of emergency room visits have been at CPEP and where those patients are going. And to the extent that you can also provide by zip code. I'm just trying to get a handle on, we know that the demand has skyrocketed. We know that there are more people out on the streets displaying signs of psychosis, et cetera, that probably need inpatient hospitalization. And we know that the city can't provide it. I think either they're discharged or patients are sent to our public hospitals. So 1/3 of their beds are psychiatric beds, whereas in the not-for-profits, I think it's about 8% of the beds. But we know that this is a huge need, and I'm just trying to get a handle on to what extent some of the problems that we're seeing in our neighborhoods are being caused by the fact that not just you, but everyone is discharging patients that otherwise might have found an inpatient bed to be treated and properly stabilized before they're discharged.
So thank you, Sarah. I would try to, I'll see what sort of information I would gather. I cannot promise that this will be zip code parceled out, but I will try to get as much detailed information as I can to share.
Great, thank you.
All right, very good. All right, we certainly would appreciate that, Julio. That would definitely help us give some insight into this issue. And Sally, I appreciate the fact that you raised those questions. Anyone else? I don't see any other hands.
So one final thing, Steve.
Yes.
I just wanted to mention that this coming on Thursday, June 15th at 5:30, the Lang Youth Scholars Program will host their 13th graduation. This will be via Zoom. And I can share that link with you if any of the board members would like to join the virtual event. So this is a great program where, and there's enormous sacrifice for the kids and the families, where they have to come in on weekends, including summers, starting from 6th grade on through high school, to go through this program, and which is a science enrichment program that encourages, it really was encouraged to get young people involved into the healthcare field. But we know that starting 6th grade through high school, you may not know what you want to do. So, but I'm happy to say that, some of the graduates have gone into healthcare. Some of them are now working at the hospital. But most important thing is that all these students have actually gone to high school. I mean, have gone to college, 4-year schools, and doing well. So it's a great program. Thursday, June 15th.
And these from our community, is that true?
All these students come from our local schools. Yeah,
Yeah, it's the Lang Scholars Program, correct?
correct. Yeah,
All
it's
right,
it's the Lang Youth Scholars Program.
All right, thank you.
Thank you very much, Steve.
Yeah, please send us that link.
Okay, well,
All right, thank you very much, Julio. Janelle, are you with us? Janelle Edwards from Columbia University Irving Medical Center.
Hi, good evening, everyone. I'm definitely here. It's lovely to see your faces. Those of you who I did get a chance to say hello to during the naming of Healthcare Heroes Way last month. So just wanted to say hello. Kindly excuse the background noise, my child. So my report is very brief. Steve, I sent you a copy of it prior to the meeting, so please feel free to share it with the committee members.
I've already done that.
Great. So I guess the highlights would be, I'll just stick to the highlights. The Little Lion Summer Camp, due to COVID-19 protocols, is canceled this year, so it won't be offered until summer 2022. Included in the report is an opportunity to sign up for their email list so that you can get updates regarding this effort for the next summer. The Academy of Community and Public Service will be welcoming their 2021 class of inductees. While their names are not publicly available, they include 18 honorees from all 4 schools: the Vagos College of Physicians and Surgeons, School of Nursing, the College of Dental Medicine, and Mailman. So we're really excited about that, which is going to be happening next week, Thursday, June 10th, and I'll definitely provide information for the next committee meeting.
Is this academy part of the medical center, or is this an outside entity?
It's a part of the medical center. It includes all 4 schools.
The Academy of Community and Public Service
Yes.
is part of the medical center.
Yes, it is.
Okay.
Yes.
All right.
So we're really excited about the honorees this year, and their names will be released shortly. In terms of community usage for the stadium track, the track will be undergoing maintenance from June 7th until June 21st at the Baker Athletics Complex, so it will be closed. I'll also post this information on our social media, but it's also available on the athletics website. And I believe they also will be posting this information physically, so that residents of Inwood will know to expect this closure for most of the month of June. This evening, we held our
Sorry.
Yeah, go ahead.
Did you say that signs will be posted at the track?
Yes, they should be posted at the track.
Okay, I'm sorry. Go ahead.
Okay, no problem. This evening, prior to the start of the committee meeting, we had our final community health workers town hall before summer, and this covered mental health and COVID-19. It was a very intense and honest discussion about the mental health issues that were surrounding the pandemic. A recording of this will be available on our website. It usually goes live after communications does their magic about a day after. So I believe by tomorrow, I'll be able to send a link so that the members could take a look at it, listen to it, probably ask any follow-up questions that they may have.
Could you tell them to stop holding these meetings on the first
Yes.
of the month? Because
Yes.
I want to attend them and I keep signing up for them, but I'm too busy preparing.
Thursday, yes, we definitely shared the sentiment, because I can't even attend the whole meeting because I, have my prior commitment to CB12. So, moving forward, they will definitely be keeping that in mind to find a date that will allow members of the committee, to attend.
All right, appreciate that.
No problem, Steve. And I'm sure this is not a surprise, but we had the co-naming of Healthcare Heroes Way. Again, thank you so much for your support in that effort. You can see the sign on 168th Street between Broadway and Fort Washington. And one small but important thing, which we're really excited about, we partnered with the CUNY Graduate School of Public Health and Health Policy to submit an RFP to EDC to establish a pandemic research institute. So we were really excited that we were able to get information support from all 5 boroughs. We believe that this institute will really be instrumental in harnessing the information, the data, the ability of the community and academia to really come together along with CBOs to prepare and prevent future pandemics as much as we possibly can. So information about this will be forthcoming. If the RFP is approved, it'll be headed by Dr. Wafa El Sadr, who's the global director of ICAP.
Well, you're wrong, Janelle. This is not a small thing. It is important, but this is a big deal. If this comes to pass, this is a major development, and it would be great to know that this Pandemic Response Institute is going to be based, at least in part, in our community. And I would certainly look forward to working with Dr. El Sadr and everyone else in this effort. This would be a major initiative. So yes, please keep us informed as that develops.
Will do so. Does anyone have any questions or concerns?
Sally has a question.
Yes, Sally.
First, to comment on the RFP. In the future, when you apply for those kinds of things, you can always come to the community board for a letter of support. And then my question, which is pre-pandemic, I know the medical school students were staffing community health centers around town. Are they back doing that, or does that have to wait for a while?
I'm not exactly sure, but I'll definitely look that up.
Great.
I also recall you asking as to whether or not we had numbers on the students who were receiving vaccinations.
Right.
And I double checked with Ross. We don't have a breakdown by school.
Okay.
However, as part of the return to campus requirements for students, staff, and affiliates, I'll be required to have our vaccinations done by September 1st.
Okay, great. Thank you.
You're welcome.
I'm sorry, Janelle, you broke up at that point. You're saying that students will be required to have vaccinations in order to return to class in the fall?
Yes, all students, staff, faculty, affiliates, non-affiliates who are working on campus.
And I'm sorry, does that include faculty?
Yes, it does. It includes yours truly as well.
Well, I would expect you to be vaccinated.
Yes.
Whether it's required or not, you should be vaccinated. So
yes.
So students who and faculty at both the medical center campus and down at Morningside Heights,
Mm-hmm.
in order to return to class in the fall, will be vaccinated. Okay.
Yes.
All right. Very good. Okay. Any other questions for Ms. Edwards?
Do you have any anti-vaxxers protesting that?
No, we do not. Vaccination status is something that isn't widely shared. So, and another thing, a lot of people aren't physically on campus yet. We're still doing mostly remote based work. So,
Okay.
yeah, I guess. There's no one speaking, at the water cooler, saying, "Oh, I don't know how I feel about this," or expressing concerns. No one's really there.
All right. Very good. Thank you.
Thank you.
All right. Ross said that he would be coming to our next meeting. Is that correct?
Yes, he will be available for the next meeting because he is currently on vacation.
Okay. Very well. Tell him that's really not an acceptable excuse. Okay, I thought he was dedicated to this work, to his work here.
I will let him know.
Yeah, I'm very disappointed in him. Okay,
And our next meeting is July.
well, we're gonna have a discussion about that before we can.
Please, no, please, no, please.
I don't want to open that, I didn't want to open up that.
Please, no, we did not have a break last year at all. Like this is really,
No,
we have to have a break. I'm sorry.
We had
People
a
who
break
just don't
for-
have anything else to do, I need a break. So we ran all the way through
Tanya,
last year. Yeah.
no, well, we didn't meet in August, but let's discuss that towards the end of the meeting. Okay, next is Betty Lehman with your report from Isabella.
You hear me?
Yes.
Okay, I'm having some issues with audio. Okay,
Oh, it's you're in an echo chamber.
is it better now?
Yeah, I think so.
I can't hear you, that's the problem.
Oh, well, wow, really? You can't hear me? Can you hear me now? Betty? Betty, you have
Betty,
to,
can you hear us?
you have to unmute yourself, Betty. Betty?
I don't think she can hear us.
Oh, no. She was just, Betty. Okay, now we, no, there she is. Betty? All right, let's, I don't get it. She was just speaking. All right, let's move on to old business. I sent everyone the DEP list of service requests for the month of May. 198 service requests generated from people in the Board 12 area. Top of the list was complaints about noise, construction before and after hours, 23 complaints. Hydrants running, 15, and then hydrants running full, which is a different category, another 15. So really there were at least 30 complaints about hydrants. And I've sent that list to all of the committee members. Also the street and sidewalk cleanliness ratings for the month of April. For the acceptably clean streets in April, 88.6%, slight reduction from March when it was at 90.1. On sidewalks, I know a lot of us are going to have problems with this. The acceptably clean sidewalks for the month of April, 99%, and for March, it was also at 99%. I also sent people the update on the water main and sewer installation project going on currently in Washington Heights. Is there any other old business? Okay, under new business, I have two items which I included on the agenda. First of all, and I also sent people the patch articles in regard to both of these issues. Councilmember Levine issued a 10-point plan on noise control after he consulted with the Washington Heights Inwood Task Force on Noise, chaired by Tanya, and apparently also with the Facebook group Washington Heights Inwood Respectful Decibel Levels. And I'd like to read off his 10-point plan. The first item is to develop a residential parking permit program to reduce noise making on residential streets. A residential parking permit program will also curtail out-of-town cars in our neighborhoods, ensure residents have access to street parking, remove the unnecessary double parking and other congestion issues from our roads. Number two, develop a vehicle ticketing program via license plate instead of driver's license for excessive noise from stereos and mufflers. Number 3, study the deployment of noise sensing technology to measure decibels and identify areas of need. I think that's something that I think I would like to have the committee pursue. Number 4, expand speed and red light cameras and keep them operational 24/7 to help ensure speed laws are obeyed at all times. I believe that's something that's going to require a state authorization. The state actually controls the red light camera program. Number 5, fund community building campaigns designed to inform New Yorkers about the fire and safety dangers of fireworks, as well as the health impacts of excessive noise. That kind of a campaign couldn't begin soon enough. Number 6, push to ban all non-essential helicopter flights that cause unnecessary noise pollution in Manhattan. This committee passed a resolution on that subject a few years back, and the full board passed that resolution. Number 7, increase the cost of summonses and fine gas stations to better discourage the use of illegal ATVs and dirt bikes and discourage gas stations from allowing ATVs and dirt bikes to fill up without being on a trailer. Sounds like a good idea to me. Number 8, audit and update 311 to make the app multilingual and to better identify multiple reports for the same issue. Sounds good to me. Number 9, update the city noise code to better reflect the needs of communities, specify the types of technologies that are available to monitor sound, and detail types of activity that are contributing most to our soundscape. I would definitely like to get more information on that point. And number 10, deploy traffic calming devices to slow traffic and make high speeds impossible in hot spots that experience sharp increases in drag racing activity. I'd say we've had drag racing in parts of this community all over the place and on main thoroughfares, including on main thoroughfares. And I'm not sure that the answer necessarily is in those areas would be traffic calming devices, whether or not that's feasible. But all of these are certainly worth exploring and pursuing. Tanya, do you have anything you'd want to add to this?
Yeah, a lot of these came out of our work. Yeah. And I think it's really great. Like I said, we've been pushing really hard for elected officials and others to finally address these issues because we had a year of silence on all of this. Back in December, our task force had DEP at our meeting, and it was at that meeting where we asked about, because that meeting was focused on the noise code, and our task force wanted to learn more about the noise code and wanted to get some, just some general information about, who's responsible for what portions of it, et cetera, et cetera. And at that meeting, we learned it hadn't been updated since 2007. And DEP, even felt that it should be updated. And so our task force began to pursue that. And I had a meeting with Councilmember Levine and DEP to sort of try to push that forward. How can we, start the process of updating the noise code? And so this is, that's where it is. And so it seems like he is definitely trying to move that forward, which is great. Because 2007 was a long time ago. A lot of things have changed, and it's also very murky in terms of, it's clear in terms of who's responsible, but a lot of challenges were brought up in terms of from the NYPD and then the Parks Department and others in terms of people who are authorized to enforce parts of the noise code. So those sort of things need to be reflected, and maybe perhaps things change and alter to reflect new realities of the situation. The license ticketing program via license plate, that was definitely an idea that DEP had at our meeting in December. They talked about how when they get these cars that have these older mufflers and et cetera, that they end up summoning the person driving and not the owner, and that you know, to see if there's a possibility to target the owner of the vehicle, you know, would probably be a lot more effective. So that also came out of that. And of course, you know, we know about speed cameras and things like that. There's a need to figure out ways to increase that. And of course, there's legislation out right now, the Furious Act and then the Sleep Act and others that are trying to address some of these dirt bike situations. But yeah, I think it's great he's getting involved. And as you know, also Gail Brewer came out with her own recommendations that was specifically targeted to dirt bikes. So people are coming out with their plans. I believe Scott Stringer also came out with a noise plan. And then another candidate for mayor, last name McGuire, came out with a plan for fireworks. So it's great to see people, you know, addressing this because it's a real issue. I said, Betty, so you know, like there was some fireworks going on near Isabella Center a few days ago, and I sent an email. Betty was CC'd on that to the FDNY and to the NYPD, the 34th, about that. You know, and I sent the video that was shot by a community member to address these sort of ongoing issues and problems. I think that the challenge right now is to figure out how do we get enforcement on the ground as we try to work towards some of these longer term solutions. How do we mitigate what's going on right now on the ground? Because it's not okay to tell people, well, as we try to work out the noise code, which could take a long time to update, and as we try to work out in doing this audit of 311 and all of the wonderful ideas that Councilmember Levine has and Manville President Gail Brewer has and others, people are still suffering from fireworks. The dirt bikes are still on the street. It's, you know, things need to be done now to figure out how to address this on the ground. And I think that is where the challenge is. I can say that there's, you know, the police department is saying that they lack resources, at least the 33rd, that they lack the resources. They would like to have 311 vehicles to respond to these kind of complaints, and they don't have the funding for that. The fire department is saying that they don't do enforcement, that you know, they're limited in what they can do. The Parks Department, of course, had a budget cut, and they don't, you know, so there's a lot there are a lot of challenges in trying to address things that are going on right now. And that's really, as a task force, where we're concerned, where our concern lies is how do we get immediate mitigation and alleviation of these problems, because people can't live like this, you know, for an entire summer again. And it's just not okay to ask our community to do that. I'm sorry, I didn't mean to go on as long as I did, but I just wanted to, so I hope that answered your question, Steve.
Definitely. But I'm particularly interested if you hear that the council members introduce specific legislation on any of these topics. I would like to bring that to the committee right away. So please if you hear anything from the council member, and I'll contact his office as well.
Yes.
Let's make sure that we can provide any support and then help push things along. And
Absolutely.
I'm definitely interested in seeing whether DEP or Levine. I think it's more likely that DEP would be the entity that would come forward with a proposal to update the noise code.
Right. Yeah, I don't know what happened since we had that meeting. But I do know, you know, there is some you know, efforts to push that forward. I was going to say, Stephen, I don't know what you think about this, but one of the things that I thought the community board could do is that we could do do a resolution of our own in support of these recommendations of not only our task force recommendations, which would be great because I think there's solid recommendations that are very holistic, but also other, expressing support for the need to address these issues and that recommendations are out there and advocating for these things to be enacted.
Well, that's one reason why I put this on the agenda today.
Could we not introduce a resolution in support of Sleep and Furious? Because that is legislation that's out there being considered today.
Well, in fact, I think I just heard that it's making its way through the state legislature. That maybe it's already been approved by the assembly and is now before the state senate. There's been some progress on that legislation. Well, Sally, what was your point? That we should or should not do a resolution?
That we should. I mean, given that there's active legislation that's now being debated in Albany, given that it's election season, it seems like a really good time to do a resolution, if not in support of all the recommendations, which I think would be a good idea, at least in support of the legislation that's currently being considered.
Yeah, with that, I don't know if you recall, but public safety had a resolution.
Yeah, we already did this.
That about the Furious Act, and
Okay.
so that has already been come before us. Right now, I think what we need to deal with are some of these real recommendations of things that are very specific to our community, based coming out of community engagement. And I think I'm happy, Steve, you and I want to work on, or anybody else wants to, I'm fine, but I just think that the community board needs to end its season making a statement that we have all these recommendations out there, but they need to be enacted and they need to be financed.
I'd like to ask
Steve, we have some hands up.
Yeah, okay. Which hand was first?
Well, mine.
Okay, go ahead, Carol.
But no, I'll let, Barbara, go ahead.
I have a brief question, but I think it's very important. We've recently discovered that speed bumps have been banned in the city and are being removed. I would like to know, how did that happen? And under what aegis was this done? Did the city council, Department of Transportation, what? Saying that, catch this, everybody, that it was dangerous to motorcycles, especially, and bicyclists, but motorcycles. Well, yeah, speeding motorcycles would have a problem with speed bumps. That's the whole point. So I really think that that should be reinvestigated, and I want speed bumps back. And I want to know who lobbied for this, or who got this through, or what this is about. Because so-called speed humps do not deter traffic at all. I mean, if you've seen them, there's no kind of deterrence with a so-called speed hump.
Well, you do have to slow down to go over the hump, but
not really. No.
But this is the first I'm hearing that they're being removed. I actually find that pretty hard to believe.
Have I ever steered you wrong, Steve?
Well, let's not go there. But do you remember where you heard this from?
Go to 311. Go to even on 311. Fixing on speed bumps.
I think the DOT has a website where you can request that, or they did. So I wonder what they say
did,
now.
And then it says no longer allowed. No longer allowed.
I'm sorry. That's tell me again where that is.
I will show you on my phone in a second. Okay.
All right.
Well, while she's looking for that, I had a real quick thing for Tanya. I don't know, like Facebook groups and stuff you're on. I know you can't be everywhere, but I did see just yesterday there was a Facebook post about Bennett Park, that people were setting off fireworks in the park. Like, we've certainly seen them on the streets, nearby, but this was right by the chess tables in the park. So I just want to make you aware of that.
Oh yeah, I saw that post. And when we see that, we forward it to the parks department, send an email to all the folks we've been engaging with, just like I did with the one with the fireworks at Isabella. I sent it right over to the powers that be and said, we need this addressed, because we can't have this sort of thing happening next to Isabella Center like that. It
I'm
was
sorry,
real.
that email about the fireworks at Isabella,
Yes.
that went to, tell me again where that went?
I sent it to the people at the fire department and the NYPD 34, including Peter Andrea,
Okay.
and others that we have dealt with. And I sent it to CC Betty. I sent the video.
Right.
Look
All right.
at my picture.
Okay, I also had a discussion with Betty the other day when she called me up. I have to look up the legislation that I worked on when I worked for Councilmember Michaels, that we passed back in the 1990s, saying that zones around nursing homes would be considered quiet zones. So we need to bring that legislation back to the surface. Okay, but Barbara, what do you have?
Look at my picture.
Well, it says speed hump versus speed bump.
And then read the bottom.
I can't get to it.
Where's that from? What website is this?
The Department of Transportation.
Okay.
All right.
But
Maybe
Barbara, if
copy
you
the
could
link
read it,
and
it's hard
email
to
it.
see.
Well,
Okay, I'll read it to you. Okay.
Okay.
I'm just showing you the bona fides,
Okay, go ahead.
Okay, a speed bump, usually 12 inches wide and between 3 and 6 inches high, forces vehicles to travel slow as 15 miles per hour, creating a safer pedestrian environment. Speed bumps are sometimes found in parking lots and toll plazas. However, they are no longer legal on city streets because their height can cause motorcycles and bicycles to lose control as well as vehicle damage. I say bubkus.
No,
So, but Barbara, what you're talking about, I think they're saying that speed humps are
Right.
still okay.
yes.
Yeah, and humps don't do bubkas in terms of calming traffic.
Well,
Speed humps are launch pads for motorcycles to do wheelies.
I mean, there's one on my street and it's
There's one on mine too. Yeah, I
not
agree. It doesn't do
terribly
anything.
obstructive.
It
Yeah.
does nothing.
I don't
It's a
think that a lot of
launch
people
pad.
see it and then they
Diving
go
board.
at the regular speed and then realize afterwards that they went over it. But
Yeah, it's a launch pad.
does it
Does
define?
nothing.
Does it give you the height for the speed hump versus the bump?
The hump is lower and longer,
yeah.
lower
I mean,
and
the one on
longer.
my street's at least 2 feet, 3 feet
Okay,
wide.
all right. Yeah, all right. So yeah, they've only been doing speed humps for a number of years. They stopped doing the speed bumps quite a while ago. Sally,
Just a time check. It's
Yeah.
8:03.
yeah, we're winding down. Sally,
Yeah, two comments. First on the fireworks, we're also having them at Inwood Hill Park, but it appears that the police reaction, especially in 34, I think 33 does a better job, is it's not our job, we're not allowed to touch it. And I think the situation, Isabella was one of those where someone, said this is going on. They were, steps away and the police said, we can't touch it. Or maybe that was at Yeshiva. So
Was
they're
that
still
Yeshiva?
saying that this is what's being come down to them from City Hall. But it seems like 34 is doing nothing. And then I also had a question about the new initiative to collect these illegal dirt bikes. They had this big announcement. They said they're giving people $100 each. There have been many instances that I've seen on Facebook of people trying to report locations of speed bumps where 311 has no idea. And so it seems like it was basically a press conference, but it has no teeth. And I just wondered if anyone had any comments on that or what to do about that.
I can say that people have been asked to provide information. Our group, our task force did put out a Google form and collected about 50 responses of 50 locations. And we were some, I was met with not a lot, but some pushback on that. Because there are people who feel like they shouldn't even know where these bikes are being stored or even operated or filled up with gas and things like that. But the police are saying that they need the intel from the community. Like, if you know where this is going on, please tell us so that we can do operations to crack down on that or to confiscate the bikes. And so, what
Has there been
happens
any,
after that?
right? Has there been any feedback from 34 in terms of how successful that initiative was? Because I
I
thought
did
that
ask. I asked them how many bikes they have confiscated. I can give you the number that the 33rd gave me of how many they have confiscated to date. Hold on a second. Sorry about that. I have that right in front of me. Okay, yeah. So I asked how many, and they have 33.
Which precinct?
Oh, I'm sorry. Wait a minute. Let me get no. This is the 33rd that we're talking about, the 33rd precinct, in terms of how many bikes they have confiscated to date. Sorry, I gave her. Hold on, I have to scroll to it.
it seems like 34 is doing nothing. 33 seems to be very active, and Charlie Bello seems to be getting back to people's emails, but it seems like 34th is just on vacation.
Cheryl Miller in the Q&A is saying that Captain Billow said that they had confiscated 31 bikes.
Okay, 31. Yeah, I was off. Yeah, I have that. I have that information. Yeah, so they did. They have confiscated. And I asked the 34 how many they had, and I haven't got an answer yet. But
these are bikes that are actually in motion, that are going up and down the street.
No, they cannot chase. So if they're moving, in some cases they have stopped people, but they don't chase. So how they came about getting these bikes, like it wasn't during the chase for sure, because they're not allowed to do that. But they probably stopped them as they were stopped at a light, if they stopped people, or they, ran, discovered that they were, not legally licensed or whatever, and got them that way. But yeah, but but they are, trying to target locations where they're being stored, and also, places where that are servicing these bikes. To try to figure out, how. But the problem is, you have elements in the community that people we don't want you to do anything. Okay, the police can't chase it.
Right.
We don't want, okay, but you don't want them to do like passive sort of intel like this, which is find the storage places or find, kind of go at it based on areas where they're being kept or housed or serviced. And so it's like, well, what do people propose to be done? Just allow people to just be terrorized every night? I just don't understand, because people that are saying this don't have any solutions. So, because I haven't heard any. But these, the police are responding to people's concerns about, no chasing, and they don't want to criminalize people in that sense and engage in that, but they do want these bikes off the street, and they're, I do know that this effort did include the 34 as far as confiscation of these bikes. Like, that wasn't just the 33rd. That is a NYPD thing. So the 34 should be engaging in that. If they're not, that's another conversation. I didn't, from what I did give them our information that we collected, and said and gave it to them. And so they do have that feedback from the community.
Well, I tell you, 31 bikes is 31 more than we've seen in a while. I mean, at least something is going on. And
Yes, and
I wish they would publicize it more so the word would get out that maybe this is not a place where you should be running up and down the streets with your dirt bikes.
right. So the action motion is happening. Things are happening. Like I said, we're happy that the police are taking these actions, that there are things that's happening right now, because even 6 months ago, this was not happening.
Right. But 3 months ago, maybe. Very
3
good.
months ago, it wasn't happening.
Right. Now, remember there was you had a meeting a few months back where you had DEP and the police department agreeing to work together to
Yes.
stop. What was it specifically on the dirt bikes, or was it something else?
They were doing some operations about like altered vehicles, street level noise stuff, and they did do some operations from what I was told, the 33rd did. In some cases, I don't have exact statistics in front of me. The results were very limited. Maybe one summons was issued or something, not a lot. But I know that they did do some operations together. The 34, I think that we had a meeting with them, and I know that they said that they were having a meeting with the DP. That was about a month ago, that they were going to start doing operations too. But the idea is to measure the noise, have DEP do their role, which is measuring the noise level, and then the NYPD does what it's supposed to do. And then together they could find people who are in violation of the noise code, because the noise code contains certain decibel thresholds for vehicles and dirt bikes and things. I mean, for motorcycles.
But what wasn't it also made for vehicles that were blasting loud music?
Yes. So all of that. I don't have all the details about their intel operations, but I can definitely ask for more detail about that and whether they're comfortable giving to us. But I can definitely ask. I think it's, we need to get more details. Seems like these things are just done. I think they did maybe 2 or something. I'm not gonna, again, this is not to be quoted because I don't know how many exactly, but I know they have said, I've been told by Charlie Bello at 33rd that he did do some joint operations. I can definitely ask for details about, specifically each operation and what it yielded.
And we should encourage them to do more of it.
Yeah, and the 34th, I want to find out from them where they stand, where they are in terms of their operations. With all of this, like I said, I did put out the
Are
inquiry.
they having a precinct community council meeting between at any
Yeah,
point?
they do, but they do. I don't think, from what I'm understanding, these things are not coming up, or
These are also questions that Ebenezer could be bringing up at his district service cabinet meetings, and
right.
we should be asking him to raise these questions on a regular basis.
Yeah, and I wasn't able to be at the public safety meeting last night because I was in land use. So
right.
And I know that they were talking about this a little bit last night, but I will definitely inquire about specifics with the 33rd in terms of the couple of operations that they did and what actually yielded. Yeah.
But you should also feel free to have Ebenezer raise these questions at the service level. I mean, that's
and he should bring them up at the borough service cabinet meeting as well.
He could do that too, but certainly when you have the local commanders and other agencies in front of you at a district service cabinet meeting, that would be an appropriate venue.
And just from the chat, Cheryl mentions that the 33rd precinct community council meeting is June 24th.
Yeah, I don't usually go to those because I just don't find them helpful, but
yeah.
I'm just saying, I don't, but people are welcome to go and pose these questions if they want to, and see if they get answers there. But
we have our own mechanism at the community board through the district service cabinet, and we should be utilizing that.
I agree.
We should be utilizing that mechanism to raise these issues as well.
But I do think we need to, I think there needs to be something type of response from the community board about, like I said, I really would love to put together a resolution about, that the community board is supporting, you know, these ideas to rectify this problem.
Mhm.
So
Steve, there's a hand. Barbara has a hand.
Yeah, Steve, we kind of dropped what I brought up about the speed bumps. Could you have Ebenezer find out how this happened and who was responsible for repealing speed bumps? Through what mechanism of government this happened? In other words, you know, DOT, city council, how?
Well, I would suppose it's DOT maybe, but
Well,
Barbara, send Ebenezer an email and ask him to find out.
I'd like this to come from the committee,
Okay, all
part
right,
of the quality of life issues.
okay, all right. I'll ask him. Okay.
So Steve, what was next on the agenda?
Next is
Evacuation centers.
no, right, the hurricane evacuation zones. So
Oh, before we go there, Steve, so are you open to like this resolution from this committee?
I am. Are you moving that we pass a resolution urging that the city council and others
Adopt these recommendations? Yes, I am. I'm moving that.
Okay. Is there a second?
Second.
Excuse me?
Second?
All right.
I'll second.
Okay. Betty can second.
Hold it. Betty is back in action?
Yes, I'm sorry, I had trouble
Okay.
with the audio.
Okay, we'll get back to you in a moment.
So what are we, before we vote, what are we voting on? Because I know that, Tanya, you've issued recommendations. I know that Gail has, I know that Mark has, I know that Robert has, I know that Scott Stringer has. So what is it that we're voting on?
Well, at the moment, we have in front of us Mark Levine's 10-point plan. That's what we have specifically.
Well, we also have our recommendations for the noise task force. We had 29. We had that weeks before. So, you know,
Can we have maybe just like a resolution for the next meeting? If that's not too.
I'm sorry, say that again?
Well, no, because the thing is, I'm not going to be in a July meeting if we have one.
I did not say July. I said the next meeting. And I do not want a July meeting either.
Okay. Well, this is the only opportunity that we have, because if we're going to have a resolution, it would need to go at the general meeting. And so it will probably need to pass through, you know, needs to come out of this committee in order to be presented, or it would have to come out of executive, you know, which I personally don't want to do. But, you know, there are these recommendations out there, and it's a culmination of all of these different efforts. And I just think that, you know, we're saying that people have smart ideas out there, and we are asking, you know, I don't think it should focus on just Mark Levine's 10 points. I think there are so many other recommendations as well that are out there right now, including our task force's work. And there was the Gail Brewer's recommendations and some of these other things that have come out that I think
There needs to be some sort of either a culmination, or we're looking at something, but it's not something we're going to look at tonight.
No, we're not going to look at it tonight.
Yeah.
No. This is just to say that we're going to devote to that. We're doing this resolution, right?
I also hesitate to endorse Mark Levine's 10-point plan, although I like Mark very much, because that almost sounds like endorsing a candidate, which we can't do. And I hesitate.
Right.
I think that what I would feel comfortable with is if Tanya and Steve took from Gail and Scott Stringer and Mark's recommendations.
And our task forces. We did this first. We did it first.
8 or 9 of the major points, and they did that, and then put that in the executive session as for something for the general meeting. In other words, you know, those general points, which we all know are so important. And then the fact reflected in 3 or 4 different political candidates and the group for respectful noise levels and such is fine. Everybody can draw their own conclusions.
And obviously, I think the executive committee isn't, the ideal option, but if we want to get it in, there's no way we could do it now here.
Right.
So, but if like Barbara was saying, if Tanya and Steve and others who are interested want to do the work and put together the points, I think that's something the committee is in support of.
Yeah,
No,
I'm
we
comfortable
did
with
a
that.
fireworks resolution at one point that was going to be co-authored with public safety. Where did that end up? It never happened.
Oh no, but right now we're talking about this because I can't deal with history and that ain't got nothing to do with me. So this right here, right now, is what we're dealing with, and I think that we could, say as a board that there are these ideas, these culmination of these ideas out there that are sound, and we could list some of those from the different entities, and we could say that we want to the city hall or the mayor's office and others who have the power to do so to enact these changes.
So Steve, are you okay with that? Taking this to the executive committee?
Well, I really would, I would really,
I don't want.
I'm really not thrilled with that idea.
I'm not either.
What's
I'm
the
not either.
alternative? Tell me the alternative.
Uh,
Waiting till September?
well,
A summer of hell.
I mean, we
I don't know.
we have the gist of the resolution now.
That's
Well,
why I asked about the fireworks, because that is the summer of
I
hell.
don't want that, but that's not that.
But we
Okay,
already passed
that-
the resolution.
The
I mean-
fireworks, I don't know what happened with that. It has nothing to do with this, what we're talking about right now. It's not this, what we're talking about. That's one aspect of this noise. It's not everything.
It's things like
Fireworks
the
is
police
just
being
one
given-
aspect.
Issue with Tanya. It's
problem,
like
the
the
problem,
police being given decibel meters, things like that.
Right.
well,
It's so many other things. It's not just fireworks.
the problem.
No, I
So-
understand that. I'm just saying that that we had made progress on one aspect, and I just didn't
I
know.
know,
what-
but I'm just trying to get us to deal with this right now. I hear what you're saying, but this is not, I'm not trying to go back in history and talk about somebody else's, whatever they were doing. Like, I'm talking
what
about what
we were
I'm
doing.
trying to do right now. I don't know.
Well, the problem as I see it right now is that we need to be able to focus on on a set number of recommendations, and we're looking at we're looking at 10 here, 29 there, X number there, the X number over there. Somehow we need to be able to sit through.
Here, Steve, I have an idea. There are all these plans that people have come out with since we came out with ours. There are similarities. So we can take, the things that everybody somewhat agree on, you know what I mean, in the recommendations and focus on maybe those.
Yeah, the
You know what I mean?
Yeah, well,
The intersection, right, Barbara, the ones that intersect.
all right.
And that narrows it down a lot.
I know, but I would just be more comfortable if I had a grasp on that right now and knew exactly what it is.
Right. Without them in front of us, we can't really vote on anything.
That what we're supporting.
Right. But we can vote on to take the intersection,
Right.
of which supplying the police with decibel meters,
Well, I don't.
encouraging
Let's
the
not get it. We don't need to get into all that.
to help
I mean,
with the confiscation of the dirt bikes,
Yeah.
to have a proactive approach to stopping the fireworks.
We're in broad support of many of the plans and their efforts to,
including
ameliorate the
those and not
situation.
limited to.
Right.
End of story. And if
Right.
those three got acted on, we would all sleep a lot better.
Right. That's the pretty much the gist of it. It's just
Included but not limited to.
right. And we can specifically name the ones that are intersecting amongst, across all of them, which there are some.
Active enforcement of New York City noise codes.
That's one.
That's it. That's all. it
That's
takes.
that's definitely one
Mhm.
that is.
So, all right. So do we need to vote on anything or no? I'm
Yeah.
just trying to move the
Well,
agenda.
Well, if we're gonna pass a resolution, yes, we need to vote. All right, so we get, Tanya and I will come up with some kind of resolution that will somehow concisely summarize or highlight some of the major features of these various plans and speak to the fact that we are supportive of these efforts now to address the persistent noise problem in our community.
Yeah.
Steve, I gave you
Because
four.
I don't think anyone's against any of the points per se. So I think it's safe to say move forward how you best see fit on that.
We'll try to circulate something to the committee members beforehand.
But
So,
Steve, I gave you the big four, and that's those, including but not limited to, and those big four, and that's all you got to do.
So what's next, Steve?
next would be to vote on this idea, this germ of an idea. So I don't see everyone here. Oh, Jay has just appeared. So can you raise your hand if you're in support of this resolution? So 1, 2, 3, 4. Jay, where are you?
Yes.
5. 1, 2,
Sally is 5. Is yes. So
5,
that's
6. All right, so all right, so it's me, Betty, Tanya, Daryl, Sally, Barbara, and Jay. 3, 4, 5, 6, 7. Okay, none are opposed, none are abstaining. And Mary, do you wish to cast a vote? Is that a yes? Okay, very good. All right. Next item is thank you. Tanya, we will be in touch.
Yes. Thank you, Steve.
Okay. Okay. Next, I
Thank you.
forwarded to you an article from Patch and then later on a map of the latest rendition of the hurricane evacuation zones published by New York City, and it seems to show that the Inwood area in particular is impacted by these evacuation zones, and zone 1, which appears to be the one which is which would be most severely impacted, is just north of Isham Park, west of Broadway, and then there's a similar zone along the Harlem River, south of 208th Street, going down towards Sherman Creek. And what I think what I would like to do, and then there are various other zones, zone 2, 3, 4, 5, and 6, spread out elsewhere in mostly in Inwood. The rest of the community does not appear to be affected by this. There are edges along the Hudson and Harlem rivers, but they don't impact where people live. So I don't know who would be evacuated over there, but Inwood would fall within these evacuation zones. So what I would like, I guess, at this point is to invite somebody from OEM to come to our next meeting and talk to us and explain to us how these evacuation zones work, because apparently they're not exactly the same as flood zones. Flood zones appear to be something else, according to the OEM website. So I would
right.
like.
Flood zones have to do with insurance rates.
Yeah, but it does, well, maybe a little more than that, but certainly the flood zones do impact insurance. So I guess my suggestion is that we have somebody come to our next meeting and talk to us about the evacuation zones.
And Steve, if you could just make clear to them too, if they could maybe even talk about specific buildings or specific blocks, that would be helpful.
Well, I tell you, if you look at the map, you will see specific blocks that are in particular zones. And it
Right.
would,
I just want them to be
and it would be
fully
interesting
up
to
to
find
speed.
out how they draw the line between these blocks that are right next to each other. Sally, you have a comment or a question?
Yeah, my comment was that you're right, we are at risk, and there are no evacuation zones in Inwood. Actually, not in northern Manhattan, and so I'm concerned about that. And I know,
I'm sorry. Oh, we
there's-
definitely have evacuation zones according to this map.
right, we have no evacuation centers.
Oh, centers. Yeah, the closest one is at PS 48, and I believe IS 90. There are two schools in Washington Heights,
Right.
but not in Inwood. I'm
Right.
wondering. That's one of my questions. I'm wondering, is that because the schools in Inwood are within the evacuation zones, and therefore it doesn't make sense for people to seek shelter there? But that's
Washington can't be.
that's definitely a question.
Yeah. The other thing is, I think they could also address at the same time the cooling centers, because we lost with the library, we lost our cooling center in Inwood. So I think the other thing to address, especially with summer coming on, since it's also with DEP, is cooling centers.
All right, well, that involves then maybe the next discussion as to whether is there a consensus on whether we should or should not meet during the summer?
I would like to meet, but I think I'm alone in that. I just think the issues that we're having with fireworks, with all the noise issues, are just going to skyrocket this summer.
I don't. Last year, like I said, we met all the way through, and even though we did meet in August, we did have that noise hearing, that public hearing on noise in August, which Steve and this committee was very involved in. So it didn't feel like we were off in August at all, at least not for me. I mean, unless it was something really, really urgent, like honestly, like these noise issues are going to be going on. Like, I don't know what us meeting is going to do.
Well,
I don't know.
I'm sorry, I didn't mean to interrupt.
No, it's okay. No, I was just saying, I just don't know what us meeting as a committee is going to do to impact any of that. If we get this resolution done, that's our statement as a board, and that goes out to people. So it's like, I just don't know what us meeting in the summer is going to do to change any of that.
I guess from my standpoint, meeting also means that the groups that have to report to us, like DOH, the hospital, et cetera, have to come back to us with answers. And I don't want to have to wait 3 months to get the psych data. I don't want to have to wait 3 months to get reports back from the health department in terms of, if we know that in fact there is hesitation about the vaccines, that's three months that we don't really get an update for the community on what's going on with COVID.
Yeah,
So
then we
my-
have to address burnout on this
to
board.
discuss-
We got to
I mean,
address burnout then, because
Mhm.
this is insane. Like, I'm sorry, but
No, I
This is
agree. And
insane.
honestly, this was the structure of the board. Like, we're not, I mean, it's not like we're all going away for 2 months. We're still here in the community. And, a lot of things will be talked about over social media. I think we can still do things with Ebenezer and Steve and others, without formally meeting. So I would just suggest not meeting during July and August.
All right, that's 2-1. Jay and Barbara, Betty, do you want to weigh in on this?
I think I support the idea of a resolution.
Well,
I don't-
you already voted for the resolution.
Right, that's
But
true.
the question right now is, should we meet in July?
I don't think it's going to produce anything because, well, I've heard over the years, July meetings are great for discussion, but you can't really take any action because it's not a regular meeting. It's a committee of the whole or something special. So if we are not able to take any specific, specific action, then just the meeting is just, it goes nowhere. So I'm thinking,
Well, as Sally mentioned, it would still be a meeting similar to the one we've had that we always have, where we have where we have DOH and a hospital and others come and report to us and give us updates about COVID-19, which from my frame of reference is still a very important issue, and it's something it's hard to walk away from.
my question is, who would show up?
Well,
Because
we.
I mean, yeah, you can't,
We
it
hope
can't
we-
be counted for attendance.
Yeah. No, we,
Less to me, who shows up on the board, it matters more to me that the agencies that we're dependent on to address the COVID crisis, to address the lack of psychiatric hospitalization, et cetera, that they have to report to us. Y'all can skip the meeting. I just want to make sure that it's not 3 months till we hear back from the hospital, that it's not 3 months that we hear back, given that it doesn't seem like the vaccination centers are getting the traffic. We really need to expand the effort to go to where people are instead of having them come to us. So I just want to.
I mean,
have
that,
both of these
I hear what you're
report
saying,
back.
Sally. It seems like an email, like that, you know, if we don't get an email by July 31st
well, we, yeah, we.
with an update, we
We-
could email back saying, hey, what are the numbers? And they'll get back to us.
Well, I don't want to, I wouldn't wait till July 31st.
It was just a random date.
Okay.
So, yeah.
Barbara and Jay, do you want to weigh in? Barbara, Jay? All right.
Jay just unmuted himself.
I'm trying to.
Oh, there, we hear you. Oh, no, we don't.
Unmute again.
Do it again.
Yeah. You were successful for 30 seconds,
Not even.
not even. Barbara, what happened to you? Okay. All right. Well, it looks as though we're,
Jay, you're unmuted now. Don't touch. Oh God. Now, okay, you're good now. Don't touch anything. You're good.
Just speak. Speak.
Just speak.
come on, Jay.
Oh no, he muted himself again.
No, he's okay. He's okay.
Am I unmuted?
Yeah,
You're
yeah,
good.
No,
Go
you're
ahead.
good now.
Yeah, we're waiting for your words of wisdom.
All I was going to say is that I'm really persuaded by Tanya and Daryl's eloquence. I agree. We should not hold the meeting this summer.
All right, very good. Okay, that seems to have maybe settled it. Sally and I will just meet by ourselves. Okay. Betty, can you hear us? You have to unmute yourself.
You can hear me now, right?
Okay,
Can you hear me?
I can hear you
Okay.
now. Okay, the last item of business now is to hear your report.
Okay, well, it'll be short and sweet. Isabella continues to welcome back family and friends to visit our residence. As you know, they were unable to do that really for over a year. However, what we do now is when visitors come, they have to arrange in advance and let us know in advance that they're coming. Then they take a test, the rapid test for COVID when they arrive. They get outfitted with a PPE, a shield, and goggles and all that to go up and visit. We have had in the last 2 weeks, over 1,000 visits from family members and friends. So it's pretty lively and pretty popular. So that's good news for our residents because they've been confined, but also absent any visitors for a long time, and depression sets in and so forth. So we're happy to, yeah.
Over 1,000 visits in what period of time?
In 2 weeks.
Wow.
Yep. Also, we hosted the wedding of a grandchild of one of our residents. It was a lovely affair. We, it was pretty private, but we did, we try to make it as home-like for the residents as we can. Steve, you would ask me to provide you with some information on how many people were vaccinated.
Yes.
89% of our Isabella residents have been vaccinated, and 68% of our staff. We have it's either the resident or the family that makes a decision as to whether somebody's to be vaccinated. So 89% is pretty good. The 11%, I would say, are people, family members mostly, who decline to have their residents vaccinated.
Are the numbers of staff increasing? Are you meeting?
No,
Are you meeting?
no, it's not. The
You
number of staff is not increasing right now. No.
I mean, the number of staff that are getting vaccinated.
Oh, yes, because when we reported it a couple of months ago, it was around 40 or 44%. So now it's 68%. And we're encouraging them to get it. As you may know, you cannot require it.
Right.
So, what we do is to provide an incentive. Plus, we have regular clinics, if you will, at Isabella, where Pfizer will bring staff in to make it easier for people to get vaccinated. So we open it up not only to staff, but also to family and friends. So that goes on.
I just can't understand why people in the healthcare field would have any hesitation about getting vaccinated. You would think those people who are on the first line and who understand the seriousness of the disease would be the ones most interested in getting vaccinated. So
right. Well, there are a number of reasons. Many of them have said this was a vaccine that was released for emergency use only. It hasn't really been formally approved by the FDA. So they want to wait for that approval before they get it. I mean, that's one way of looking at it.
Yeah, that is right, but
More importantly, Betty, were you a flower girl
a what?
at this wedding?
Oh, it's a wedding.
Oh, no.
Oh,
No.
that would have been cute.
Well, that's too bad.
Yeah. Yeah.
But
Also,
but this at this wedding though, it wasn't like the other one where the resident had to just watch through a window. In this case,
right.
Everybody was in the same room.
Yeah, I mean, the family member would visit the resident in his or her room.
But when the wedding took place, though, everybody was together in the same chapel or whatever.
It was outside.
Oh, it was outside.
It was in good weather. Yeah. Mm-hmm.
All right, very good.
Then also we have the Somos Community Care is
Right.
working with Elder Plan, our Home First operation, and they're still working on vaccinating at-risk and underserved communities around New York City. So that collaboration still exists.
Great.
Um,
And that's it.
Okay.
Steve, I just had one other comment, which is to thank Mary Anderson.
Was it Leslie? You get Leslie? Leslie. Oh my God. Oh my God. Betty.
I know.
Betty, you going to send me your notes?
I'm going to, yes.
Okay. All right. Very good. All right, Sally, your question?
Yeah, it's just a comment. I want to thank Mary Anderson and the Committee for the Concerns of the Aging for all their work on reopening the senior centers. I see they're going to reopen on the 14th, which is very good news. So thank you for all your work on that.
Thank you.
Yeah. Congratulations. And we should also acknowledge the work of our borough president, maybe. All right. Thank you, Betty. And
Mhm.
Do you
are
need
there
a
any-
motion to adjourn?
are there? Hey, 1 second. Are there any announcements?
Oh,
Good. No announcements. Mr. Cochran, you have a motion?
I have a motion to adjourn
I'll second it.
until for the summer.
Oh, hold it. 1 second. That raises another question. The current schedule
Oh, yeah.
distributed by the board has us meeting on the Thursday before Labor Day. Would this committee prefer that we move it to the Thursday after Labor Day?
Yes.
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 Tanya is a yes. Darrell,
Yes.
Betty, Sally.
Yes, from Barbara.
Yeah. Oh, a yes from Barbara. Okay, so that's
Yes.
okay. A majority wishes to meet on that second Thursday. All right, very
Right.
good. This meeting is now adjourned at
Was there a second
a second. For what purpose?
to adjourn?
Second.
Oh,
Second.
Okay.
Second.
It was seconded.
Second.
At 8:45, we are now adjourned. Thank you
Okay.
all,
Thank you.
and we will see you sometime anon. Take care.
Okay. Very
Okay,
good. Thanks.
bye-bye,
Bye-bye.
everyone.
Have a good summer.
Bye.
Good night.
Bye.
Bye bye,
Bye.
everybody.
Steve, I just had a question. I know we're adjourned, but you will get that data from Julio?
I will work on it, yes.
Great, thank you.
And you will remind me if I don't get back to you.
Yes, I will.
Okay, very good. And Tanya and I will be in close consultation in the next week or two on the resolution. Take care.
Goodbye.
Bye.
Bye.